Hi, I'm Becky Robins and I'm a specialist neurophysiotherapist, and these activities are to support your core strength.
Before starting the warm-up to this activity, it is very important that carers and family members watch the Advice and Exercises for Carers video.
Okay, so we are now going to start warming up your middle to give you a bit more core strength. So this exercise is going to be done lying on your bed. So you will need a carer to support you getting in and out of bed and throughout these activities, so ensure they've watched the guidance video for carers. Okay, so position yourself in bed as you would normally. Now you may need to support your arm, your weaker arm, with a rolled up towel or a pillow. Whatever you normally do is fine for this activity. You can have a pillow underneath your head to support yourself. If you need to sit up a little bit, that's absolutely fine. We're actually going to be working on this area here. So the first thing I want you to do is start squeezing your bum. Okay, so we're going to clench our buttocks and then relax. And again, clench them as much as you can and relax. Now what we're going to do that 5 times, rest and then repeat. Now, if you can't feel any movement at all in your bottom, that's absolutely fine. It's the trying that counts. Okay, you ready? We're going to do 5 of those. Off you go. 1 and relax. 2 and relax. 3, keep going, don't hold your breath and relax. 4, relax, last 1 and 5 and relax. Perfect. Have a little breath and then we're going to do another 5. Really trying to squeeze your bottom as much as you can. Are you ready? Off you go. 1, relax. 2, relax. 3, relax. 4, relax. Last 1 and 5 and relax. Brilliant. Okay, so for this next activity, we're going to see if we can reach our hands towards our toes. Now, you may not see any movement whatsoever, but what we're trying to do is start to activate these tummy muscles a little bit. So you may need your carer just to support your arm again on a rolled towel or a pillow. Just whatever you normally have and feel comfortable is absolutely fine. And you're going to imagine moving your hands towards your toes and then coming back down to the lying position again. You may not see any movement. It's the trying that counts. So we're going to do 5. Really imagine your hands are going towards your toes and stop and then back down. That's all you need to do. And again, 2, good, and down. Again, 3, relax. 4, relax. And last one, 5. Well done and relax. We're going to try 5 more. Don't hold your breath through this. Breathe throughout. It's really important that you breathe because it means you're getting lots of nutrients to your muscles. Okay, we're going to do last 5. Are you ready? Off you go. 1, that's it. Relax. You can see the tummy muscles working. 2, fantastic. 3, relax. Last 2. 4, relax. Last 1, 5, and relax. Well done. We're going to take a short break there to go over the coaching points for this activity.
Red Group warm-up coaching points. With all movements, try to do as much as you can, but do not work to any pain or restrictions. This activity should be performed on the bed, lying on your back. Use a pillow for comfort for your head and weaker arm. Try to squeeze your bottom as tight as possible. Don't hold your breath.
Okay, so we're going to be lying on our bed again for this activity. Make sure your head's supported. If you need the bed raised up, then do so. And ensure that your weaker arm is supported on a pillow or a rolled up towel, just to support your shoulder. So for this activity, we're going to have bend our knees and make sure our feet are flat on the floor. On the bed even, not the floor. So you will need a carer to support your leg, okay? So carers, you're just going to place your hand underneath the knee and on the foot and gently move that weaker side up into a bent position, making sure the foot is flat on the bed. Now you can lift your stronger side up to the same position. So carers, you are going to have to support that leg throughout this activity. And what we're going to try and do is we're going to try and do some little side bends of our body. So we're just going to demonstrate that now. So with your stronger hand, I want you to reach down as if you were going to touch your heel of your stronger side and come back. And as you can see, as we do that, we'll do that again. You can see some activity and some muscles flickering here. That's exactly what we want to try and achieve. Now, if you don't feel any movement, that's okay. Just trying really counts. It means that we're strengthening the connections from your brain to your muscles each time you try. So it's the trying that matters. But what we're going to do with your stronger side, we're going to try now and do 3. Are you ready? We're going to reach down for your heel. Off you go. 1 and back. And again. 2 and back. Last one. 3 and back. Fantastic. Have a breather. Make sure that you're breathing throughout this activity. Don't hold your breath. You're going to try 3 more on your stronger side. Off you go. 1 and back. 2. Come back to the middle. Last one. 3 and relax. Well done. We're going to try on your weaker side now. Now, remember, don't worry if you don't see any movement. It's the trying that counts. So with your weaker side, imagine that you're stretching down towards your heel. Off you go. 1, relax. 2, relax. 3, and relax back to the middle. Big breath in. We're going to do it again. Off you go. 1, to the middle. 2, and relax. And 3, and relax. Well done. We're going to take a short pause there to go over the coaching points of this activity.
Red Group Exercise 1 Coaching Points. With all movements, try to do as much as you can, but do not work to any pain or restrictions. This activity should be performed on the bed, lying on your back. Use a pillow for comfort for your head and weaker arm. Carer or family member should support your weaker leg into position and maintain the position throughout. Don't worry if there is not a lot of movement. Think about the activity. This is really important. Repeat 3 times each side.
Okay, so for this activity, you will be lying on the bed. Make sure your head's supported and your weaker arm is supported with a towel or a pillow. So first of all, you're going to need a rolled up pair of socks or a cloth, and we're going to pop that just underneath your back, in the small of your back, so your carer can help you do that. Okay, just underneath there. Your legs are going to need to be bent. So again, carer, support your stroke survivor to bring your leg up, and you can lift your stronger leg up yourself. And for this activity, what you're going to try and do is squash the socks or the cloth with your back. So you're going to try and flatten your back as much as you can. Squash the socks, hold it, and relax. So we're going to do that 3 times. We're going to hold each press down of the socks for 3 seconds. Okay, are you ready? Off you go. Squash the socks. 1, 2, 3, and relax. Well done. Again, squash the socks. 1, 2, 3, and relax. Try not to hold your breath as you do it. Last time. 1, 2, 3, and relax. Now, if you want to have a go at this activity again, that's great. Just make sure you have a breather in between your tries. So we're going to take a short break there to go over the coaching points for this activity.
Red Group Exercise 2 Coaching Points. With all movements, try to do as much as you can, but do not work to any pain or restrictions. This activity should be performed on the bed, lying on your back. Use a pillow for your comfort for your head and weaker arm. Your carer or family member needs to be placed a rolled pair of socks or cloth in the small of your back before starting the activity. Repeat the activity 3 times.
Okay, this last activity is to really strengthen the muscles that are deep inside your body. Okay, they're your pelvic floor muscles. So during this activity, you shouldn't actually see any movement whatsoever. You should just really be concentrating on tightening up your muscles if you can. Again, don't forget, it's the trying that counts. So again, make sure you have a pillow underneath your head to support yourself, and your weaker arm is supported with a pillow or a rolled up towel to support your shoulder. Now for this activity, I want you to imagine that you're going for a wee, and then you're going to try and stop yourself mid-flow. Now don't go for a wee, you're just imagining it. Okay, so we're going to show you here, we're going to do it 3 times, okay? So imagine you're going for a wee, and then you're going to stop yourself, hold it, 2, 3, and relax. As you can see, there was no movement whatsoever. We're really concentrating on those inside muscles. So we're going to do it another 2 times. Are you ready? Pretend you're going for a wee, and then stop yourself, 1, 2, 3, and relax. Well done. Last one. Pretend you're going for a wee and stop, 2, 3, and relax. Fantastic, well done. We're just going to stop there for a short break to go over the coaching points for this activity.
Red group, exercise 3 coaching points. With all movements, try to do as much as you can, but do not work to any pain or restrictions. This activity should be performed on the bed, lying on your back. Use a pillow for comfort for your head and weaker arm. Think about when you go for a wee and imagine trying to stop the flow. It is important to imagine this activity and not to actually do this when you do pass urine, as this can risk urine infections. As you're imagining the muscles tightening, hold for 2 seconds. Rest and repeat 3 times.
I hope you really enjoyed this session. Please don't forget to like, comment and subscribe. Thanks very much.